My name is Casey Redding, and I'm a pediatric nurse on the PEDS floor at Triple Army Medical Center. And I'd like to talk to you about my strategic goal, which is to increase our patient satisfaction ratings by 10% over the next year, as evidenced by increase in our TRICARE Inpatient Satisfaction Survey, our TRIS surveys. I would like this to take place between the months of August 2018 to August 2019. This goal is in line with Tripler's mission and values. It's we want to provide the best quality care within the whole Pacific region, and we would like to do that with using evidence, best evidence. Um, the evidence shows that staff satisfaction is directly proportional to patient satisfaction. So I recommend that we start the process by evaluating how our staff is feeling. We can do this by having leaders do employee rounds where they can identify any barriers that employees might have to providing care, if what is working in their department or what is not working in their department. Um, and once we discover what these needs might be, we should make every effort to meet those needs so that we can increase the satisfaction of our staff and also set them up for success. We're unique in that our facility has a high turnover of nurses. We have a lot of military people that come through. They come to us with little to no pediatric experience. I believe that if we had our leadership collaborate with the education department, we could develop a program that would help give these new employees the necessary skills to provide safe and effective care to our pediatric patients. Pediatrics is much different than taking care of adults. They may have the same bodies, but the parameters are different. The reserve is much less. So if we have a provider in there with a pediatric patient, and if they don't notice the subtle differences in the patients in their care, it can be catastrophic. So we need to allow these people to succeed by giving them the education that they need to provide that safe care to our patients. And as for the rest of our staff and that staff, we have opportunities at our hospital to educate. And I think that it should be mandatory, at least for our floor, so that we can meet this goal, which is all 100% of our staff attend team steps, Arbinger training, and cultural sensitivity training. Providing this education to all of the employees helps them to be set up with the tools that they need to provide quality care. We're also sort of speaking the same language and understanding what is expected moving forward as far as teamwork and how we want to lead and be led. So this is easily available to us. So we should utilize it and make sure that everybody has an opportunity to get that training. Now to move on to our patients, there are evidence-based strategies that have been shown to increase patient satisfaction. Strategies such as bedside report, hourly rounds, and rounds with the physicians in the mornings. I believe that it's very important that we follow through with these well-known procedures. We should establish standards of performance and make clear and precise direction to our nurses that this is the procedure they must follow. This is not a new request that we've made, but there's been no accountability. So nobody is really following through with what needs to be happening on our unit. Nursing is very steeped in rituals, and it's difficult to get people to change the way they do things. So I think that it's important that we find ways to support our staff through that change, that we provide them with the tools they need. We can email videos to them, we can hold forums, and we can also have some role playing. And additionally, I think we need to let our staff know the reason why we're doing these new processes. I think that just saying to somebody, this is what we're doing, and not giving a rationale, it's not likely to be successful, particularly for nurses. But I think if this is framed in a way that addresses patient safety and patient comfort, it's more likely to be followed through with our nurses. For example, when we're doing bedside report, we're able to connect with our patients. We collaborate with them like as in a team. If we're reporting off to the oncoming nurse and we've missed something, our patient or family member can provide us that we've missed, or they can add something that we may not have known. It also offers an opportunity to look at um, visualize the patient as we are getting report. Often before this, we would get report away from the patient and then arrive to our patient after report and go like, what? This is not at all the report I'd gotten. So this gives an opportunity to kind of have a valid look at how our patient's status is. We can check their IV fluids, their IV line, all of their lines to make sure that they're in order, they're in place, they're draining, to make sure that our supplies are available for the next shift. That creates accountability, and it also creates teamwork. When we're doing patient rounds, those rounds have been shown to decrease patient falls. It also decreases call bell usage, which should be beneficial to the nurses. That should speak to them. And the MD rounds, if we're doing rounds with our physicians, then we're able to see live what it is what the plan is moving forward with our patients. If we're not with the team as they make these new plans, we're not on board. It's not cohesive. We appear just fragmented, and that's not what we want to put forward to our patients. We want to look as a team and cohesive, and everybody on the same page. So as orders change, the nurses and all staff need to be aware of that. Um, I think that additionally, when a patient comes into our floor to be admitted, we should sit down with them and immediately become empathetic. It's very difficult and scary to bring their family member in for us to care for. Um, I believe that it's important that we use our time at admission to ask that patient, what is it that we can do to make your stay most comfortable? What can we do so that you would score us 100% on the quality of care that you're getting? I mean, specifically ask that question, and um, and be sure that you get a real answer. Don't just be satisfied with "I'm sure you'll do fine." We want to really know what it is that is important to that patient, so we can speak to that, and we can provide the care that is centric to them. So we should gather that information, and we should share it each shift so that everybody's aware and on the same page what's important to this particular patient. That's patient-centered care. It's the very heart of what we're doing. But I think we really need to pay attention to what our patients are saying and really listen. I believe leaders should perform daily rounds on our patients to discover any wins that they might have. If they want to shout out to one of our nurses, if they have concerns or they see that there's areas of improvement. This is all intelligence we can gather and then later share with our staff on real time on how to make corrections. This is also an opportunity to see that our procedures are being followed through, that they're getting patient-centered rounds, that they're getting shift change report, that the whole team is coming to the bedside. This is important information. At the time of discharge, I think patients should be given a short survey that's focused on nursing metrics so that we can have a look at real time where we're excelling or where we need a little bit of work. So that we should have something in place that can gather all of this information. We should gather all complaints. These are gifts from our patients. They're giving us opportunity to make it a better place. Um, at the time of discharge, also, we should let the patient know that they'll be getting a TRIS form in the mail, and we hope that they fill that out so we get some really good feedback from them. Encourage them to fill that out and explain it might be a few weeks out from their discharge. Patients should also receive a follow-up call just to find out that they're following through with whatever their treatment plan is, or do they have any questions once they've gotten home. And this is also another opportunity to find out if there's something more that we could have done to make their stay better. If there was somebody that they'd like us to recognize that kind of stood out to them. This is important because this is information we can share with staff. It will reward them, and rewarded behavior gets repeated, and it can incentivize our staff when they see that there's some positive feedback. For any plan to have success, it's got to be effectively communicated, and it needs to be understood that stakeholders absorb information differently. So the strategies for communication will will incorporate audio, video, a mix of written information, and it can go through our email, through unit newsletter. We can have mandatory staff scheduled meetings, and we can email to our staff evidence-based articles monthly, just to kind of keep them engaged and let them know that we're still heading for that same goal, and everybody's still on the same page with that. We should have daily huddles. In our daily huddles, we need to talk about where we are with our plan. If there are any shout outs, we should do that in a public forum. And we can also put a communication board on display. And on the board, we can have visual reminders of where we are, successes, and maybe where we need to do a little bit of work. We can, on that board, put our current TRIS scores. We can put on the board any thank you notes. We get notes from patients all the time thanking us for our care. So this will be a place that we can put them that's everybody can see it, and it'll be of value. We can also include a place for employees to shout out to one another. Anything that we've seen that somebody's gone above and beyond. Just again, that's something that will just incentivize other staff. We can also put up on that board any education opportunities or any events that are coming up. And then our unit practice council can also post their minutes up on that board. Unit practice council should be tasked with keeping this on their agenda through the whole year. And while they're looking at this, they can continually take a look at the evidence to see if, or literature to see if there's further evidence of other things that we can implement in order to be successful. There's always new practice or new guidelines coming out, and it would be important to have that team take a look at it. Well, this plan has mandatory elements. Staff should still be encouraged to provide feedback. It's a fluid plan. It can change depending on different people's ideas or the feedback that we get from families. So it's important that we all stay engaged. And if we keep our staff members connected to the plan, they will then have some buy-in, and they will more likely follow through with what needs to be followed through with. I did forget to say on our daily, when we talk about our daily rounds that we're having every day with our staff, we should include physicians weekly in that round, so that they can give us feedback, or we can provide feedback on how we're feeling as a team, so that everybody is on the same page. I believe that this is a very doable plan. I think that I'm excited to see people implement these strategies that are shown to improve patient scores. I really would like to see that happen in our facility. If you have any other further ideas, please email me. And thank you so much for listening. Have a great day.